Good morning, all. I'm Rakshana from second MSc Biochemistry. My topic is thrombocytopenia. It is a condition of having low blood platelet count. Normal platelet count 150,000 to 450,000 per microliter. Thrombocytopenia is defined as a platelet count less than 150,000 per microliter. It affects both children and adults. Thrombocytopenia can be mild and cause few signs or symptoms. In rare cases, the number of platelets can be so low that cause dangerous internal bleeding. Symptoms: easy or excessive bruising, purpura, superficial bleeding into the skin that appears as a rash of pinpoint sized reddish purple spots, usually on the lower legs, prolonged bleeding from cuts, bleeding from gums or nose, blood in urine or stools, unusually heavy menstrual flows, fatigue, enlarged spleen. Causes: many symptoms can cause thrombocytopenia. The condition can be inherited or acquired. The bone marrow doesn't make enough platelets. Bone marrow is a sponge like tissue inside the bones. It contains stem cells that develop into RBC, WBC, and platelets. When stem cells are damaged, they don't grow into healthy cells. Many conditions and factors can damage stem cells. Cancer. Cancer such as leukemia or lymphoma can damage the bone marrow and destroy blood stem cells. Cancer treatments such as radiation and chemotherapy also destroy the stem cells. Aplastic anemia. It is a rare serious disorder in which the bone marrow stops making enough blood cells. This lowers the number of platelets. Toxic chemicals. Exposure to toxic chemicals such as pesticides, arsenic, and benzene can slow the production of platelets. Medicines. Some medicines such as diuretics and chloramphenicol can slow the productions of platelets. Common medicines like aspirin or ibuprofen can also affect the platelets. Alcohols. Alcohols can slow down the productions of platelets. A temporary drop on the platelet count is common among heavy drinkers, especially if they are eating foods that are low in iron, vitamin B12. Genetic conditions like Wiskott-Aldrich and May-Heglin syndrome can cause low number of platelets. The body destroys its own platelets. The body may destroy its own platelets due to autoimmune diseases, certain medicines, infections, surgery, pregnancy, and some conditions that cause too much blood clotting. Virus, chickenpox, mumps, rubella, Epstein-Barr virus can decrease the platelet count. People who have AIDS often develop thrombocytopenia. Mechanism of thrombocytopenia. The causes of thrombocytopenia is broadly divided into five categories based on the mechanism of a reduced platelet count. Pseudo thrombocytopenia, decreased platelet production, increased platelet destruction, dilutional thrombocytopenia, distributional thrombocytopenia. Most common mechanisms are decreased platelet productions and increased platelet destruction. Pseudothrombocytopenia. It is an in vitro sampling problem which may lead the diagnosis towards the more critical conditions of thrombocytopenia. The phenomenon occurs when the anticoagulant used while testing the blood sample causes clumping of platelet which mimics a low platelet count. It has been reported in association with the use of EDTA as an anticoagulant with platelet agglutins and with multiple myeloma. Decreased platelet production. Platelets are produced in your bone marrow. Factors that can decrease platelet production include leukemia and other cancers, some types of anemia, viral infections such as hepatitis C or HIV, chemotherapy drugs and radiation therapy, heavy alcohol consumption. Increased platelet destruction. Some condition can cause our body to use up or destroy platelets faster than they are produced, leading to a shortage of platelets in the bloodstream. Such conditions include pregnancy. Thrombocytopenia caused by pregnancy is usually mild and improves soon after childbirth. Immune thrombocytopenia. Autoimmune disease such as lupus and rheumatoid arthritis cause this type. The body's immune system mistakenly attacks and destroys platelets. If the exact cause of the condition is not known, it is called idiopathic thrombocytopenia purpura. It affects mostly children. Bacteria in the blood. Several bacterial infections involving the blood bacteremia can destroy platelets. Increased platelet destruction. Thrombotic thrombocytopenia purpura. This is a rare condition that occurs when small blood clots suddenly form throughout your body using a large number of platelets. Hemolytic uremic syndrome. This rare disorder causes a sharp drop in platelets, destruction of red blood cells, and impairs kidney function. Medication. Certain medications can reduce the number of platelets in our blood. Sometimes a drug confuses the immune system and cause it to destroy. Examples include heparin, quinine, sulfur containing antibiotics and anticonvulsants. Dilutional thrombocytopenia. It is caused by platelet loss out of the body and platelet dilution with replaced red cells and crystalloids. Usually, platelets counts in patient receiving 15 to 20 units of PRBCs in 24 hours is 50K to 100K per microliter. It can be prevented by giving up platelet concentrates to patient receiving more than 20 units PRBC in a 24-hour period. Distributional thrombocytopenia, also referred to as apparent thrombocytopenia, since total platelet mass is normal. It is commonly attributed to increased splenic sequestration in patients with splenomegaly, patients having clinical bleeding. Complication. Dangerous internal bleeding can occur when platelet count falls below 10,000 platelets per microliter. Though rare, severe thrombocytopenia can cause bleeding into the brain, which can be fatal. Diagnosis. Blood test. A complete blood count determines the number of blood cells, including platelets, in a sample of blood. Physical exam, including a complete medical history, signs and symptoms of bleeding such as bruises or spots on the skin, checking abdomen for signs of an enlarged spleen or liver, checking signs of infection. Diagnostic test. A complete blood count measures the level of RBC, WBC, and platelets in the blood. Blood smear test to check the appearance of platelet. Bone marrow test to check whether the bone marrow is healthy. Treatment. Blood or platelet transfusion. Medications. First choice drug might be corticosteroid. Surgery, plasma exchange. Thank you.